Guys, what's up? It's Dr. Dan over here. We got Andy in the house.
Hi.
Andy is a patient for a couple months now, 2 months now. Long history, we're not going to get into all of it. Mid-back pain, neck discomfort, has had an MRI. He's scheduled for a thoracic MRI to make sure nothing deeper than what we can see on his chiropractic appointments is going on. Super in tune with his body. Sometimes we can have major things wrong with us. Sometimes if we're really in tune with the body, little aches and pains can drive us to be like, whoa, what's going on, right? So this guy's been on a health hunt for probably a year now of finding what's making him uncomfortable. And you work on a computer all day, right?
I do have a sedentary job, so all 8 hours of the day, whether I'm seated or standing, I'm in this position most of the time. I do work out daily. I'm conscious about what I eat, my movement patterns, staying loose, mobilizing my muscles, working on the stability. But as Dan pointed out for the last year, just dealing with chronic headaches, visual disturbances, and so we're just trying to attack this thing from all aspects: holding patterns, diet, the method of training, and so I think we're onto something.
You're onto
here.
Something.
Yep.
What did you feel last night, Andy? Just started getting on the hypervibe really intensely. Last night we did an upper body session. You sit at a desk all day mostly, right? Mainly?
That's right.
And then what'd you say last night?
Yeah, so I mean, I need to take breaks. I need to force myself hourly to keep my thoracic spine mobile, keep the spine moving. But at the end of the day, I just have a lot of pent-up stress and tightness in my muscles. So I did the 10-minute session with the hypervibe with Dan, shook all the junk out. Honestly, didn't have any adverse effects last night with the vision. I feel great this morning. Mild soreness, but I feel pretty refreshed. Pretty refreshed.
Nice. Come back here, Bree. We're gonna look at look down for me a little bit. So guys, what we're looking at in the back of the neck, which he had an MRI, so we know what's going on, but we would have seen what's going on without the MRI. This area right here, if you can notice, is like a little more swollen than the left side. If we tilt the head to the right, and now tilt the head to the left, what's that feel like difference-wise?
More tension on the right side
when you're here,
left. Yeah.
like more tension. Let's go chin straight down to chest. And way down, roll down now. Okay. And if you notice, there's just a little bit more elevation, like a little bit more just swelling right here, right? And again, let's lean head to right side. And just notice how this line feels right here.
Yeah, feels comfortable. I actually feel a lot of junk bunching up right here.
And now lean head to left side. Turn.
More tension on the right side, not so much bunching up here.
Not so much here. So he had an MRI, and what was on there? Like a little disc bulge or a...
Slight disc bulge at C5, C6.
On the right side.
Yeah, no nerve compression or anything, but just
slight disc bulge.
Yep.
So he's got a great spine, adjusts super well, really loose. There's actually not much because he's so flexible. He's been working on his back chain flexibility. Look down for me. And when we get our hands up here right from day one, we pointed out, yeah, he's got like some right side suboccipital junk up here. On the MRI, there was a possible Chiari malformation. He had like some significant upper cervical compression, which can affect vision hands down. The cerebellum, the posterior brainstem, and the occiput can affect vision. He has some lymph nodes, light lymph nodes right here on this right side. Feel that bump right there? So that's just like a little bit of lymph node congestion, which people say, what? Oh my gosh, I got lymph node congestion. That's okay, we all have some lymph node congestion. But what are we doing throughout the day to drain the lymph nodes? What are we doing to reduce the tension up here and promote fluid movement, drainage of the fluid up here, right? So when he just hangs out in this position and he lowers, and you guys see these cuppers too, which are awesome. We'll shoot a video on the Ache the Way cupper. He got 2 of them, and he's been lighting up his back all in the right spots. You have one here, one here. I would even try to reach back here with your left hand and slap that cupper, or else have your wife do it, and open this shoulder up and get that cupper like right in here, which will help a lot of this junk right here. Cool? Sure. But throughout the day, working on the computer, leaning the head to the left, stretching the neck out. Something as simple as this, and just kind of holding for like 3 to 5, 6, 7 minutes. If you want to close your eyes, if you want to reach your jaw, your bottom TMJ called your mandible, your bottom jaw. Reach away with your jaw like watch me like how.
Like an underbite.
Yeah, like that. And I think, can I open this up?
I feel that right up to my ear.
Right up to your ear, right? Now do it on the left side. And it'll be a little tight. Not as much, right? So one of our things is like, okay, he's got some discomfort. He's had a ton of blood work done. He's had some high-level scans, some MRIs. He's getting a thoracic MRI just to rule out any bad issues. But he knows right from here. Do you feel how this side feels? Do the right side again.
Nice and relaxed.
And do you feel that side pulls more? And once you really get into it, you'll notice how it pulls up into your jaw, up into your ear, even up into your TMJ, right? So, we don't know yet because we got to get the MRI. See that there's nothing massively wrong. What can happen on an MRI? And he knows this. We've talked 9.9 times out of 10, not going to be something wicked bad like a cyst or a tumor or something like that. Always possible. I have a cyst up under my jaw that was a calcified lymph node. When I was a kid, I had like a strep infection or something. So I always feel this little bit of tension, like up in my what's called your nasopharynx, your oropharynx, back of your throat. Look down for me. But we do know from MRI, up in his cervical spine, he's got a slight disc bulge at C5, which means his neck's been twisted up, kinked up for years, maybe a decade.
Probably decades.
Probably 10 years, 20 years, who knows how long. Yeah. But the dude's healthy. His posture is amazing. But it's just a little bit of jammed up on the right side. So we need to be aware that we stretch to the left. We reach our jaw into an underbite. We lower our right shoulder down, find our right lat, and pull and drain all this tension. You know what I'm saying? And definitely as we work, he's got a right lat that's weaker than the left lat. And a little baby bit more upper trap activation than the left side. And he feels this as, let's relax center for me. He feels this as maybe like what? 1 out of 10, 2 out of 10 soreness or no soreness?
No soreness.
Versus this side.
Probably 2.
2, 3 out of 10.
3, yeah.
And if we dig deeper, this is great. This is
3, 4.
3, 4, right? So a little bit of upper trap dominance on the right side, a little bit of congestion in the right side neck, a little bit of disc herniation or disc bulging on the right side neck. Yeah, you know, he came in here, he's like, dude, I don't feel good, something's going on, I know it. And takes great supplements, exercises well, may have to get some blood work done, some follow-up Nutraval testing, look at omega-3s and all the amino acid profiles, your vitamins A, D, E, K, vitamin C. Nutraval is great to have a full micronutrient panel done. Definitely has neuroactivation to work on.
Yep. And as we've talked, about my history, I have a couple scars on the back of my head. Could have sustained some trauma.
That's right.
Played a lot of sports, contact sports, but specifically I was a pitcher. I'm right-handed. I was a bowler, so a lot of unilateral, repetitive whipping motions that could have just, built up imbalances and compensated over time. And when I became less active or changed my lifestyle, then maybe some of these problems reared its head.
That's it. I wish I showed you. I just showed the last dude how my right shoulder adjusted more than the left shoulder. We'll see if it's ready for it again. But other thing we notice, left shoulder packs back into the back chain very easily. Right shoulder stiffer. Not by much. It's still loose. We still get the glenohumeral joint to pump. We get the glenohumeral, the glenoid or the humeral head, to pump. But how's this feel?
A little tender.
How's this feel?
Actually, not too bad.
Well, we're not there yet. Hold on. Coracohumeral. There it is. Feel this spot?
Yeah.
Feel deep up under here.
Yeah, you're getting there. Yeah.
This side's soft and relaxed. This side's wicked tight.
Okay, yep, I feel that.
So, other key spots, we're going to check the chest. How's this feel?
Okay, definitely more. Oh
Feel
wow,
that
that's
guy?
just a lot sharper.
Yeah. You're going to rub this guy out for us. You could even put your cupper right up here on your chest.
Okay.
You're going to start to work on all these ribs on the right side. Definitely this rib right here.
Wow.
Bro, you're spitting
That's-
image of me. Do I have the same right rib? When I was 18, 19, I had shingles back here on my back. This is my weak spot. We all have viral infections that live in our body. We have bacteria that live in our body. All those little organisms that are microscopic, they live in our weak areas. If you haven't had shingles yet, which is the reactivated chickenpox virus, like many people, yours is probably living in one of these spots right in the mid-back.
I believe it. That's
Right
where I
here.
feel all my
Okay?
pain.
So where you feel your discomfort at, that's where your weakness is at. Where you feel your discomfort is at, that's where your weakness is at. Where your weakness is at is where things live, okay? And especially for me, who dated back my health history, I knew I had shingles on this right side of my back. It was actually like out here by the lat a little bit. But I too, and many people too, have this right rib that you're gonna start fixing right here, okay?
Yep.
You're gonna just lay in bed or drive your car or sit on the couch, and all it is just a little bit of self-treatment through the rib cage, maybe working up into the rib cage a little bit, maybe grinding out the sternum a little bit like this, working out all this crunchy stuff. Which this crunchy stuff, bro, you're on a beautiful path right now because there's still a ton to learn on how to open the chest and develop the back and get the right shoulder to match the left shoulder. Cool?
Is there any areas where I could massage, mobilize, cup, anything to loosen up that
This
right
area?
shoulder? Yeah.
Well, we're gonna do a little pin and stretch in there today.
Okay.
But definitely just cup here, move the cup around through the pec, put the cup on the front of the bicep, not so much the side of the bicep.
Yeah.
This is kind of a tough area. It gets really tender. I wouldn't set it on a high setting. I'd set it on a mid or a low setting at
Yep.
first
Yeah.
because there is some deep tendon tissue
yeah.
right here.
That's
But,
what I did on the left side. It was the
yes.
lowest setting, and that bruised that much.
Yeah.
I mean, it doesn't take much. Maybe just do less time.
Yeah, and then you can stop it halfway through.
Yeah.
But once you start to feel as we work on this right shoulder, oh man, dude, I know your path. I know your path. Because I had the same stuff. All right, guys, we got the ached away scraper today. Cool thing about this is our first time using it actually. It's got a double beveled edge, nice big handlebars. Probably going to use this more for spine work, more for lat work, more for upper trap work. But it does have a little bit of vibration. It's very minimal vibration therapy. But it also has 3 different heat settings. So you can go 40, 45, or 50 degrees, and right away this thing starts heating up. We'll see if you feel the heat a little bit. Let's try to roll shoulders forward a little bit and chin down to chest. And you tell me, since this is my first time, if this is a little, tell me if it gets too hot.
It's actually pretty comfortable.
Nice. Chin way down to chest. Oh, nice. This dude's gonna feel free after this.
I can feel it. It's
Oh
pretty
my
bristly.
gosh, brother. Now gently straight chin or head left. And
You can probably dig in there pretty good. I can feel a speed bump there.
feel that guy.
Yeah.
Now back to here. Let me get a little more. Center it up. And let's go hands here. Let's go head down to chest. And lightly think about elbows round forward. Head to left.
That heat feels good.
Does it? You feel the heat?
It's relaxing, yeah.
Nice. Same head spot. Let's go down here. Is just treating upper trap, rhomboid, mid back, right around the scapula, bro. There's so much junk up there, isn't there? A little bit of junk. Look up, look down, look up, look down, look up, look down, look up, look down, look up, look down. Nice work. Now we're going to finish up. We got a few petechiae to break out. Definitely around the right insertion of the trap on the scapula, coming over to the acromion. A little bit of tension through there, but where his problem is at, major problem, which is minor, but it needs fixed, is chin tuck back. Is definitely that area right up here, homie. Look down. Now center. We're working deep up into what's called the mastoid process, the SCM muscle. Right up on the base of the occiput. Look down for me. Oh, sorry there. Chin down. And guess where all that works up to? Deep up into the brain, bro. Right here a little bit too. We gotta keep working on. Free skull. Gotta have a free skull. Chin tuck. A little more down. Nice. Now let's do that. Nice, not bad. Head injuries, scar here, scar here. Jams up the head. Down the road, we're going to talk about rolling on these spots. Some funky wall stuff to do. Roll your head out on a wall to readjust and align and stretch and decompress the cranial bones. The sutures up in the head. My bro's going to start working this right side TMJ right here a little bit. You're going to start rubbing this spot out a little bit, okay? That makes sense. You're going to get your finger up here.
Yeah.
And I'm working on the right side TMJ, but if it was on the left side, he's going to work right in front of the tragus. The tragus is the little ear flap of cartilage right here. We're going to start to rub and press and work out. Oh.
Wow.
Right side or left side?
Right.
Right side. Feel that in there? Left side feels calm. I always ask because sometimes patients have small pain spots in different areas. But definitely the right side neck, right TMJ. So he's got to work on this right TMJ big time. And you'll start to feel this right jaw is all stretched out. And then the ear needs to be, we're going to go through ear work. Definitely on this right ear. Talk about that after. Cool? Cool. So if I say hands down, shoulders open, This is good to see on camera. Well, you have cupping down here too, but let's chest forward, upward. Bree, come back here. All right, so we're gonna focus on the line down into his lower lat on the left, and the lower lat on the right's way up here. It's like an inch higher. So tall sit out, low back. This side's already visibly more active versus right side. He needs right lat, lots of right lat, lots of drain of the right neck, lots of strain and power into the right lat. Hold here. To left, look how easy that is. There goes the adjustment. If I say push through the right, feel how much, and I say right, but right index finger, right? Now shoulders open. Where's all this stuff at?
And it's funny because my right side is generally stronger. That's my
It's
dominant
not
side.
strong. It's weaker down. We got to work right neck, right trap, and did a little bit with the Ached Away. This is cool. You can find this on Ached Away's website. I think we have a product link that we'll post below for it. Go face down for me.
It's great.
Now, Andy also knows he has rocker position to do. Rocker position owns up into the feet, the knees, and up into the pelvis. And ultimately, when we maximize the rocker, we learn how to tie the connective tissue flexibility the whole way up into the neck and the right shoulder. Both those guys pretty good. Let's do toes, 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 big toe. Nice. Toes, toes. We'll get these up too. But left foot's, there it goes, a little stiffer. All right. Inhale deep. Exhale deep. Shoulders down. One more breath in. Breath out and down. Relax mid. Good. Breath in. And exhale out and down. Nice. One more in. And exhale out and down. Nice. Dude's already flexible. Last appointment was just a couple days ago. And we hit CT junction for the first time. And right side to side, he gets a little jammed up on right through here. So he's going to keep attacking this region with his at-home cupper. Does that make sense?
Yep.
You feel like that guy right there?
Yep.
It's only a little bit, bro, but I think that you're really in tune with it. So it's driving you, relax here, up a wall. Let's go left side up over to me this way. Right? I got it. I'm like, oh, God. And then guess what? You got to wake up in the morning, you got to loosen all your stuff up.
Right.
Okay, hands crossed, breath in, exhale out, roll, 1, 2, other side. Dude's flexible, spine moves. So we got to tune in down deep into the deeper layers of core. Exhale, whole way out, flat on your back for me. Lots of deep work. Come into the gym, you got slant board work. Got to own the squats. The deeper you get into the layers of squats, the better they get. Now right foot. Now. Down the road we got right posterior chain work, a little bit of left. But touch feet together. Where did we find out here was different? Squeeze together. Not too bad, right?
Right.
But
Opportunity was
building
opening up that
strength.
right knee.
The right knee, right? So the right heel's the tighter heel, just a little, and yep, you're just gonna work that at home for the pelvic floor gradually. Trying to drive knees open further while maintaining touch through the feet, okay? Left knee open, and then right knee open and left knee open. Cool.
Is it okay to bring my feet up and
You could do a little bit more, right? Which is like this, and then also focus on forefoot pressure. All right, dude's got great calf activation, but if you hone in on the calves, which takes time, like I know my right calf's my dead calf that I have to work on. My right knee's my tighter-ish knee. My right hip gets a little funky. So you may notice as you squeeze together, and if I say pull right knee open and work that for like 30 or 60, and then pull left knee open, and just start to feel how the front of the hips stretch out. Ultimately, the hips are trying to get further back into the butt muscles. You may get cramping on the outside edge of the hips. You might feel straining in the front of the hips. Okay, legs down. Cool, got that? But that's a, whoops, sorry there. That's a good position to work. Now, right fingers. Relax hand. Good. Good. Got finger work to do, which is our flexibility through our front chain of our arm. And we have not had his elbows to adjust yet, but they will come. Hand here. He's got some deep core up in the upper body, which for me, my elbow, I know I can like loosen both up real quick. He's a little tight on the medial elbow joint. We just got to tune in. We got to figure out where in his body he's got to take the tension out of his fingers, forearms, and put back into shoulders open. So he knows he's going to be working, and he's going to be working on his right pec a little bit. Definitely like this region, the rib cage. You're going to start to grind out this. And once you start to feel this one or two ribs that are crooked, man, you're going to learn how they tie right into the mid-back area. One more. Relax this. Nice. Already adjusted, bro. Shoulders down. Nice. And, oh, there's your decompression. Huh. One more. Huh. Good. Sit up tall. Spin to right for me. So, buddy, here's the deal. You're going to get stuck on some levels. Levels mean diving deeper into body control. And you might be stuck at a level for 2 or 3 months where you're like, I don't know where to go next. But if you stick true to the exercises, both those shoulders adjusted awesome. Eventually, Nick in the gym this morning says, bro, I figured it out this week. A new level of foot control that he started to feel and how it ties up into your knee or hip. You got to work hands on hips, butt here. Soft, flat palms. Soft, tall sit out of the lumbar spine. Soft, set down, correct. I already like the left side. Just feel that soft, flat hand rest there versus the right side. Notice how you got to work the right side. Super easily. All you can do is put in more time, more reps, more awareness into this right side, which what I'm talking about, he's feeling, you guys don't feel. The super minuscule amount of neurological brain muscle control activity into this left side lat, into the flexibility of the left bicipital tendon. Even if I say in this position, push the hand into the hip now and focus on the ground into the body with the tricep activation with the shoulder down, okay? And try to really kind of hone in. When you hone in on the tricep pushing in, man, you're gonna get like this guy to strain and cramp up. There you go, now it's tighter. But now let's go softly, don't push yet, but roll down and back, and now push hand in that position. This side will burn, cramp, strain more, shake more. Look at that shake already, you're listening. See the difference here? So he needs more back chain activation through right side. Now back to left side. Don't even lean into it, but just set open first. Correct, lift head up tall. Lower hands down a little bit. Focus on left down, right there. Now hand push straight in right there, don't move anything. Nice, correct. Load that push, 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 push. Push, 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 come back here. Push, push, push. Now do the left side. Let's show, see how the left triceps firing deep, 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 deep. Twitch, twitch, twitch. Now he's working max back chain hand push. Build this tricep. This side will grow and strengthen. Now let's softly roll over to right side, open and down. Now right hand push. What do you feel?
Shakes.
More?
More.
Harder?
Yeah, definitely the tricep activation.
You're going to feel in the hand, maybe it's pushed through the knuckles lately, the calluses. Maybe it's pushed through the hand lately. Maybe it's feel how this blows up and now this stuff's all going to start to come back to life. His delt's active, his back chain's active, his triceps active. Boom, 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 boom. This side's way different though, right? Than the left side. So if he doesn't build this pattern, guess what? Long term, the neck deteriorates more, the disc herniates more. Years go by, you complain about your neck, your shoulder over and over and over again. You don't fix it. The right arm starts to die as we get older. Don't let that happen. Build your lats, build your back power, build your posture, build your awareness of your front chain openness so that we end up with, and maybe it's a little neck stretch, we end up with healthy neck as we age, lots of oxygen, blood flow up into the brain, we feel better, we're happier. Gotta be happy, gotta love exercise, that's my thing. If you watch the channel, you gotta love exercise, you gotta love hyper vibe. Dude loves it. Dude loves fitness, obviously. He's worked out, he's got big before me. Now it's just fine-tuning the neurological system. So every rep that he does in the gym, whether it's a bench press or a tricep push down or whatever, is balanced. For me, when I was a kid, and I used to bench press and think that 225 and 285 and 315 were heavy, and my right arm used to fail, and I'd be on the bench and I'd be like this. Right, my left arm's like this. You remember those days? And like, oh, help me, my right shoulder's dead. It happened to you too. I know it happened to you too. You got a spotter, your spotter says, dude, why is your right arm dead? Well, because you're not balanced. You're compensating up in your neck. You do it again and again, disc bulges. MRI shows that. What ortho tell you to do with MRI? PT or something?
Yeah, they said follow up with a headache clinic and consider, pain management.
Pain management. Take these pills. See you later. Poison your body. See you later.
Injections, nerve blocks.
Oh, nerve blocks. Your nerves are trying to tell you you're in pain. You want to block them? No freaking way, dude.
It's a Band-Aid.
Band-Aid. Don't do it. Get strong. Get fit. Get mobile. Use the hypervibe. Exercise. Do your rocker. Self-care. 8-to-8 cupper. A little bit of at-home postural awareness. There's tons of videos on the channel. Check them out. Do them. Cool?
Cool.
That's all I got for you today, guys. Andy, Dr. Dan, thanks for watching. Peace out. We'll see you on future videos.